Hello, everyone. Good afternoon. I trust God that you're fine. Today is Trisha's voice, and with you is still your favorite girl, Ambassador Patricia Godwin. First of all, I just want to apologize for coming late. Not really late today, but I think for about a month or more, we've not had this class, and that's not my fault. I've been busy and working with other things, but I'm so sorry. The last time I promised I won't stay long, but this time around I think I didn't fulfill that promise. But this time around I'm not going to go that long anymore. So today is Trisha's voice, and today's topic is the long-term consequences of female genital mutilation. Yes, in our last class we talked about FGM, female genital mutilation. We talked about the meaning. We talked about types. We talked about the equipment or tools used. You understand? And then we talked about some consequences and risk, but we talked about the short term. So today we'll be looking at the long term consequences. It was a long class, or a larger one, so I couldn't finish up on that day. But I'll just go through it and just give you a brief, so that you join up with what we had the last time. According to World Health Organization, female genital mutilation is seen as all process that involves the partial or total removal of the external female genitalia. We've talked about this before. Or injury to the female genital organs, either for cultural or any other non-therapeutic reasons. Remember I said non-therapeutic reasons. Till today, they have not been able to give us any reason why people go into this practice, other than other flimsy excuses of this and that, of which we've talked about it. So we talked about the types, and we have about four major types. There may be other subtypes, but four major types. Number one, the clitoridectomy, which is just the partial removal. You understand? Don't remove everything, just the clitoral hood is what you remove. And then the type 2 is the removal of the full clit. You know that in this class we don't pronounce things the way you expect. You already know. But I'll try to use some short forms, like some short terms, to explain some things, so that I don't go contrary to the rules, knowing fully well where the class is. In this platform we don't say things like that. So but we still have to find a way, because we have to make this class work. So when you hear me saying clit, you should understand what I mean. Okay? And then when you hear me saying S.E.X, you should understand what I mean. And sometimes I want to say S education, you understand what it means. So these are some of the key terms we'll be seeing in this class. And then we talked about the types, the sona, and which is the removal of the clit hood, you understand, and then the labia minora, you understand. And then you talked about type 3, which is infibulation. Infibulation is terrible. In fact, it's terrible. That one has to do with the removal of the clitoral hood, and then you remove the labia minora, and they remove the labia majora, you understand. And once all these key things are taken away from the woman's organ, you notice that you're just empty. And sometimes that one goes as far as also involving stitching, and then VG opening. VG opening, you should get used to VG right now. VG opening with a minuscule hole for urination and menstrual bleeding. That is to say, they have cut the clitoral hood, like the, I don't know, hood, you understand. They have cut that part out, and then they remove the labia minora, they remove the labia majora, and then they still stitch it again. Like they now stitch in everything and remove just a very small hole, very minor hole, that you can use to urinate and then for menstrual flow. So we're still on it. And then we talked about the type 4. The type 4 is called unclassified. This unclassified has to do with a lot of terrible things in it. A lot of let's say stitching, stretching, dragging, and a lot of things, you see. And then this one involves the use of herbs. Sometimes they'll you know how those people do, they will just cut some herbs, squeeze it, and then put inside the woman's body, and then they'll be telling you it's going to do something, it's going to do this, it's going to tighten you up, it's going to a lot of things that causes issues. So we've talked about this in our last class. I'm just trying to refresh your mind so that you know, like I said in the last class, that FGM is a forceful act and is performed with the victim being held down by many women in the society. Sometimes not only women, they go as far as bringing men. You understand? Come and hold. You see somebody holding your daughter's leg and the hands, and then this process is being carried out. So, and then we talked about causes. In fact, let me say tools. We talked about the tools. What are the things we use? We talked about razor blades. We talked about knives, sharp knives. We talked about sharp irons, like some irons you'll have to give it to, how do we call these people? Welders, to blend or sharpen it, you know. Some sticks, a lot of things. Scissors goes with it. Broken bottles, is that bad? So now, I also mentioned that some of these items you see, or these tools you see used, are not sterilized. You get, they will use it on the first person, the second person will want to, even if it's 5 persons, they will use it. So they don't even care about STIs. You get, so that's not the topic for today, but I just wanted to refresh your mind. So right now, we are going straight to the causes, long-term causes. We've talked about the short-term causes. Okay, let me just brush up from the short-term consequences of FGM. We talked about it's negatively affect the natural functioning of the female reproductive system, and it violates human rights. You understand? It's the excessive pain can make a female to go into shock that you cannot recover. You know that process, you're not being given any injection. Unlike if you're going to the hospital to do maybe a surgery or whatever, they'll just give you injection that will, injection that will make you not to feel the pains that much. You understand? But in this case, your eyes, they open. You're seeing everything. You're feeling the pains directly. That's why it's cruel and it's so bad. And then the next one we talked about, excessive bleeding will happen, which could cause hemorrhage. Yes, hemorrhage. You start having issues. Uncontrolled bleeding and the rest. And then there are complications that comes with urinating. It also happens with excessive, or because of labia, because of they have taken the labia majora out and the labia majora. So now you can't urinate freely. And then we've talked about so many things. Many infections are bound to happen. You understand? Now we talked about that the female genital mutilation is mostly done under unsanitary condition, using non-sterilized sharp objects. So I've already said that. You will see, if you google it, you will see what is going on. You see a girl child on the floor. The floor is dirty. They're not even doing it in a clean place. Not like, like in the hospital, if you want to carry out any operation, they will sterilize everything, cook some of their tools and a lot of things, and then they'll take you to the theater and then attend to you and make sure that you are safe from any kinds of infection. But this one, they even take you to the bush. They feel is dirty. So sometimes they'll keep you on a leaf. Sometimes you see them spraying wrapper on the ground, on the floor, to just keep you there, and with all manner of dirt around. The fingers, the nails, everything, so it will cause infection, So we've talked about this extensively in our last class. So in this class, we're going to talk about the long-term risks. And number one is FGM and cutting has major effect on sexual and reproductive health of a woman. Out of all the types of mutilation, out of the 4 mutilation, the type with most negative long-term effect is type 3. Infibulation. Type 3, infibulation, because that one has to do with cutting off the major part of a woman's organ or the woman's veggie. The pleasurable parts is taken off. The part that is supposed to control urine has been taken off. The one that is supposed to aid menstruation has been taken off. And then they stitch it all together again. A lot of things. So This type is very dangerous. Very, very dangerous. And then point 2 says childbirth is immediately affected when female genital cutting happens. You notice that in the last class, if you go through the last class, I told you that if you don't call it female genital mutilation, you can call it female genital cutting. Some persons call it female circumcision. So, but I said it earlier that if you say female circumcision, may not really give you a clear meaning. You understand? So we use the word mutilation because you mutilate the place. And when you mutilate a thing, it cannot go back to its original stage. Mutilation means interrupting a thing, destroying or distracting a process, a good process. So once you mutilate it, you have dirtied the thing. The thing is now not good. You get? So that's what it means. In infibulation, the clit dot stories and labia majora and minora are removed and the vaginal opening is sewn together. Now, you know that normally the woman's body or the woman's vagina has a hole. So after taking off the other parts, after taking off the Grace, you're here. Welcome Project Grace. I appreciate. Thank you for being part of my class. So when you cut the major things out, they now go ahead of stitching the hole, like that hole. You understand? They reduce the hole. So let's say if the hole was like this pen, I had already made this illustration, they'll reduce it to this. You get? So what you're surviving with now is like this side has been sealed. So anything that is coming towards this side will have to struggle its way down or out here. And some persons have heavy flow while menstruating. They have heavy flow. So this heavy flow you see, when it's coming on a normal, it's supposed to go out freely. Your monthly flow, your menstruation is supposed to go out freely. Nothing is supposed to hinder it. But you notice that when it gets to this particular place, it will get stuck because the hole here is narrow. So it starts going out gradually, trying to find its way out gradually. And in the process, some of them may find their way to a particular place to get stuck. They just find their way anywhere. In as much as I know that it will come out, but you may not know if actually all came out. You understand? And how are you even sure that in this process of stitching and closing up, you did not do one thing inside that you don't even know what the implication will be? So this is bad. Now that's for that very point. Because of this closing, there is almost no chance of childbirth, even though premarital S.E.X is untimely preserved. Now, the reason why we have talked about reasons why people go into FGM in the last class. Some could be cultural, some could be traditional, some could just be to give a man satisfaction, and some will say they want the place to be tightened up so that when your husband is having an intercourse with you, the man should enjoy. And then some will say it reduces promiscuity and all that. But at this point, they only consider that very part, and they have not considered the life of the woman involved. Now, after all this preservation and protection from maybe parent and guidance or community people, have you thought of the well-being of the person involved? This is a woman. She's going to get married one day, and definitely she's going to have S.E.X. There will be sexual intercourse between her and her husband. You've not considered that part. And then the ultimate thing that makes you a complete woman, childbearing. You're going to have a child. How do you push your baby out when the place is closed? So that's what that part is talking about. That's what that part is talking about. And then the next point says there are also long-lasting injuries that could happen, like 1, genital and reproductive tract infection. Yes, it causes infection. You will see some pus coming out of a woman's body. You are trying to trace where it is coming out from. You don't know. You understand? A lot of things. And then cyst and scar injuries. Example, tetanus. Like I said, or as I said earlier, that they don't sterilize those tools. You know, most of these things are done in the village, very interior. So they don't believe in one person, one surgical blade. They don't believe in that. So once they buy one blade, they can decide to use it. Project Grace Foundation, thanks for coming to my class. Thanks for being a part of my class. I really appreciate it. Thank you. Thank you. So now, you that you use one object for 3, 10, 4, 5, 6, 7, 8 persons. You don't know who is clean among them. You just feel they are all okay. So that's how it spreads. You have infection like cyst. So all these things that are going into your body are not trying, and there's no way to go out. They only go in, they don't find their way out. Because you have cover up everywhere. They will just go and find their way inside. And you know how the woman's body is. The woman's body is. The outer part is closed and locked. That's how God made it. That's how our Heavenly Father made that place. It's tight and closed. You know. So anything that goes in beyond may not be able to survive. So sometimes they go into a particular place and form one thing or the other. Some of these fibroid you see people having, you don't even know how it comes. I keep asking, what's the cause of fibroid? And I keep hearing stories like the clot of blood, some particles of blood, when the womb stays for so long and doesn't have anything to carry. The womb is supposed to carry something. So when there is nothing for the womb to carry, the womb will now start looking for 1 or 2 things. Or if anything goes in, it will just, you know, swallow up and start forming some kind of things. And then they call it fibroid. I don't know if I don't. That's what I've been hearing, and I've been trying to get the real cause, you know. But I know that if you have clots of blood inside your body and they don't have their way out, they could go in and see form fibroid. That's my own. I don't know for you. So that's what that point is talking about. Infection. And then the next point is, because of the sewing of the veggie opening together, there could be an accumulative of menstrual flow at the vagina and urethra. I have said that. Urethra. I've already said that. They will go and find themselves within the vagina and the urethra. So, no way to go out. They'll stay there and start looking for their own name, whatever thing they want to call it. That's why some of the things you see women go through, some of the infection they have, you cannot even place it. You don't even know how. So these are one of the causes, you know. FGM is one of it. These cause major diseases, infection, and could sometimes turn to fibroid. I've already said that, fibroid, you get. So the next point says it leads to infertility. Yes, it does. Because when you give access to some infection to go into your body and settle at the key places where baby is supposed to be, where the baby is supposed to stay, and then some other things have already occupied that place, it will block you. It will block you. Some of the things you hear, block tube, block this, block that, a lot of things. You don't know how it starts. Infection could be the reason. That's why if you stay for too long without having a child, they will want to know what you have been doing. The doctor will want to ask questions, what have you been taking, and all that. And there is a particular scan they will ask you to go and do where they clean the tubes and the rest of it. So it's possible. And then the next one is a higher risk of newborn death. Yes. It causes higher risk of newborn death. You see children dying anyhow, babies dying. Healthy baby cannot come out. Why? Because the place the baby is supposed to come out has been tampered with. If person lock gate, you go fit pass. You no go fit pass. You go need key to unlock. So it's just a primary on a layman way of explaining these things. They have locked the place. The place is closed. So how do you? Do you understand? How do you? And then there's what we call episiotomy. It's what we call episiotomy. If you're trying to put to bed in the hospital, and the baby, maybe the baby's head is out, or the baby cannot even push the head out because of how tight the body is, the doctor will say, okay, let's do episiotomy. Episiotomy is a surgical incision of the perineum and the posterior vaginal wall done by obstetrician, a professional, a person that has been well trained to do that. Now, the question I'm asking this our mothers and our fathers and the people who are doing this FGM, where did you get your training from? You're not a medical doctor. You just stayed one day and you feel that should be removed. And then because you don't know these things, they don't even know what to cut and what not to cut. In as much as I don't support any cutting. What are you cutting? Do you even know what you're cutting? They just feel they know it. So, and this thing is very bad. They are all very bad. You understand? So the newborn baby, if you're like in the village, we have what we call traditional midwife. When you're pregnant, you meet one person at home who does home delivery and the rest. Fine. They've been trying since I was born. In fact, they have done so well for so many persons. They have been in the village helping people. They've tried. But my question is, when you get to this complicated stage, you have done FGM on this woman, and now the baby cannot come out because the place is tight. How do you do it? Do you know some of those local people even go as far as doing episiotomy? They will cut the place and bring out the baby. Oh yeah, stitch it back now. Wahala don't come. You understand? They will cut. Some of them are wise enough. The same way they have been cutting, they will find a way and cut the place down. There is first degree episiotomy, there is second degree, and I heard there is third degree. Don't know if there is fourth degree. Oh, that is to say they keep cutting. Now, the person is not well trained, and the person is cutting. The cutting, she may not even know whether the cut she is giving to this woman is the first degree, second degree, or the third degree, and they may even cut what they're not supposed to cut. You see the problem. You see the problem. So when the baby is now out, let me not talk about the death of the baby. The baby is now out. How do you close it up? You notice that some women are just going around, their body is open because of the problem caused by where they came from or whoever that was, maybe parent or guidance. You see the problem. They go on like that. So it's not good. It's not even advisable. It's not right. Then the next one talks about talking about child's death. When the baby cannot come and come out, you know, sometimes the nurses will say, baby is on the way, or baby is on the way. And the baby is coming. And the baby has been standing on the road since. Till the baby will suffocate and die. Because there's no way for that child to come out. The baby cannot come out. And then the local midwife doesn't know what to do. That's why you see them. They'll start rushing from the village to come to the hospital in the city. By then, the woman they go. When a woman labors for too long, she will be weak. The energy will sap. She will bleed excessively. And she may die. So when somebody is in labor, the chances are just very between life and death. So you don't even risk anything. You don't risk anything. The next point is severe bleeding leads to death. Yes. Hemorrhage. If the cut is outer, it's simple. But when the cut is inside, that something interrupted me. So when the cutting is outside, you know that there's going to be a problem. You understand? You know that there's going to be a problem. So, but when it is inside, there's going to be a problem. But when it is outside, you can manage it. So the next point we want to talk about is sexual problems such as pain during intercourse and decreased satisfaction. I'm telling you, we're still talking about the long-term risk, the long-term consequences of FGM. Pains during intercourse. How does it come? The place is closed. The man is struggling his way in. And each time he does that, the woman is feeling pains. S.E.X is something you're supposed to be happy with your spouse. Something you're supposed to be enjoying with your spouse. It's not supposed to be a painful thing. You understand? It's supposed to be a pleasurable part of your relationship or marriage. But some persons have already taken that part away from you. You get? So as you're there, you're always in pains. And that would discourage you. You understand? Each time a guy will say, let's go inside. You just start, your heart will start pumping because you're going there to feel pains caused by the people who felt they were protecting you. And then the next one is decreased satisfaction. You cannot be satisfied because you're in pains. You're in pains, you can't enjoy anything. So there will be no satisfaction there. So you see the issue. And then the next point says, need for later surgeries. Example, the sealing or narrowing of the vaginal opening. Type 3 may lead to practice of cutting open the sealed veg. when you start complaining too much, I cannot, doctor will give you lube. So even we can meet doctor will give you lubricant. You can't still use it. With the lube, the thing is not still working. They will tell you, okay, come, let's cut it small. They will go and cut it again, stitch it again. You understand? And give you space just for you to have intercourse. So now who is feeling the pains? The woman that is feeling the pains. That's why World Health Organization is far against it. If you're caught, you go to jail. All of you. If you're caught, you go to jail. Share my videos. Let them hear it. If I see you, I'll report you. Honestly. Personally, if I see you, I'll report you. I'll not hesitate to report you. And you'll be arrested. So share my videos. Let them hear. If you have a parent or guidance or neighbor or any leader, any community still practicing FGM, tell them it's against the law. Tell them it's against the law. World Health Organization is against it. Once you're caught, you're going into prison. They will take you to jail. They will jail you. So don't say you're ignorant about it. Because people are suffering because of it. Since I started mentioning all these things, have you heard any part I said it's good? None. All for selfish interest. So when it is like that, they'll have to go and cut it again, and you go through the process of pains and all that. You understand? So a lot of things, and then later allow for intercourse and childbirth, and that process is called de-infibulation. You know, infibulation is the one they cut it off and tighten it up so everywhere. So when they go back to cut it again, just for you to have your pleasure and have your child, it is called de-infibulation. You understand? So the next part is sometimes genital tissue is stitched again several times, including after childbirth. Hence, the woman goes through repeated opening and closing procedures, further increasing both immediate and long-term risks. Yes, increasing both immediate and long-term risk. You know, there's how they call this, I don't know, sometimes scars. As a result of always cutting and stitching, you will start having scars. And those scars will just be there. I don't know how they even call it. I think, is it tissue? I don't know. There's how they call it. There's a particular name for it. You see it pop up and remain there in that place where that stitch, where they stitch. It will remain there. You have to go through another surgery to go and cut it and level it up. A lot of things. So right now we are going into solution. What's the solution for FGM? What's the solution? What's the way forward? What should we do? Now that this thing is like, what should we do? Okay, we have decided we are going to stop it. How do we educate people? How do we make people come to understand that this is bad? Number one. So, World Health Organization has developed a global strategy against FGM. Against FGM. It's a global strategy, not only in Nigeria. If you go to US, go to UK, wherever, Canada, go to anywhere you want to go, to London, it's against. No country is practicing FGM under World Health Organization. When you are caught, you know that this is inhumanity. It's not right. You tamper or you trample upon women's rights. When you do that, you have trampled upon their rights. You have taken the right of a woman into your own hands. Now you feel you can just control and do anything you like. It's against the law. Now, the first thing they are saying is World Health Organization has developed a global strategy against FGM. Medicalization with partners, organization, and continues to support countries in its implementation. They are going around different countries, you know, to make sure that this thing doesn't work, this thing doesn't go on again, this thing doesn't go on. The first thing is, and then they challenge the discrimination or discriminatory reasons for FGM or why it is practiced. Some persons have some reasons. In our last class, I talked about some reasons. Some people will say, I don't want that to be promiscuous. I want to preserve her for her husband. You know that in the ancient time, everything was just about husband, man. Women live all their life to please men. I'm so sorry. Apologies to the men. But that was the order of the day. Everything a woman does must, at the end of the day, must please a man. Because the thing you're cutting is in favor of the man, not the woman. The woman goes through pains. It is her job to go through pain. It is her job not to enjoy S.E.X. People believe that you're not supposed to. You have not seen relationship where a woman will tell a man, I have urge for S.E.X. And the man will say, what? Why would you? You're a woman, you're not supposed to say that. You've not seen, there are situations like that. Some men don't even want women to even tell them, I want, or somebody will say, honey, I'm honey. Sweetheart, I'm honey. See, what is that? You're a woman, you're not supposed to say that. It's only a man that is supposed to say that. You know, a lot of things. So we are growing, so we need to teach people. People have to learn a lot. Even in relationship, some guys will tell you, I don't like when a woman will come to me and tell me she wants me. How? You know, they feel if you do that, you're a promiscuous person. You get? They feel you are a bad or you're a spoiled woman. That's just fallacy. That's ignorance anyway. They don't know, and that's all they know. But I want to tell you that it's not supposed to be so. S.E.X. is supposed to be enjoyed by both men and women. How you even enjoy? How do you even feel? You're enjoying yourself, and your woman is not having fun. Is not enjoying. She's only squeezing her, crying, and each time you call her, she will not want to. A lot of things. That's ignorance, and we should grow above it. That's what World Health Organization is saying. One of the ways is to create awareness, and that's what I'm telling you now. And the next challenge is change traditions with the support of older generation. Change tradition with the support of older generation. The same energy the older generation use in deceiving or giving such energy, deceiving or advising people to do FGM. They should use that same energy and do the awareness that is bad. Because even they themselves, they know it's bad. How many grandmother or mother will want to do that now? They have come to terms that this is bad. So many risks we are having, and I think mortality and death, a lot of things that we are having now is as a result of that. Because when a woman is pushing a baby, all the things that surrounds her body, the labia minora, the labia majora, the clitoral hood, a lot of things are supposed, all this part have a lot to do. You understand? As the baby is coming, the body is supposed to stretch. The body is supposed to stretch. Just like you, just like, how do I say, a tube. Have you seen a weak tube and a tube that is still new? When you see a tube that is new, a small tube like this pen can stretch to a long length. You understand? But when the tube is weak, if you just start stretching it, it will cut. That's what happens. The thing that is supposed to help the woman stretch and her body opens for the baby to come out has been cut off. So whatever is stretching now is the real skin of the woman. It's her real body. It's not the flesh, the skin. You see how the hood is? It's skin-like stuff. That's how it's supposed to be. So when you take it off, the woman is at risk. And then another solution is that educate girls on their right to decide what happens to their body. Nobody has the right. Young girls, I'm talking to you. I even forgot, I didn't include you in the flyer I made or the post I made for this class. I was supposed to invite you, but I'm sorry about that. You can still join and learn. You are the one to decide what happens to your body. Let nobody decide it anymore. From 18 years in Nigeria, you're already an adult. Somebody is dragging you to the village to go and cut your body. Tell the person you will not do it. Report that person. If it's your dad, report her. Report him. If it's your mom, report her, sorry. Go and report her to the police station. Tell them what she wants to do. Because you will be the one suffering. Do you understand? Go and report. Nobody will kill you. You're only protecting yourself. So you have the right to protect yourself. We want to take you to go and do fattening room. I'm not against the fattening room. I'm of the culture. I'm not against it. But if you want to do your fattening room, you want to make your child, get your child fatten up, you understand? You can do it, but do not tamper with her body. Don't touch any of her genital organs. Leave her alone. Whether you want to take her inside the house, massage her. Some people do that. They'll go and massage you, start giving you food because you're too skinny and all that. With those old and those belief that a woman must be robust and round and all that. You can do that if you want. But don't touch her body. World Health Organization is against it. The law is against it. Government is against it. Even Nigerian government is against it. So don't say you did not know. And then the next one is speak out about the risks and realities of FGM. Exactly what I'm doing now. I'm creating awareness. I'm speaking out that FGM is bad. So you can also do that. Do your flyers, do your posters, inscript it anywhere, in your car, make posters, make billboards about it. We need these people to survive. There should be awareness on this. People should know. And then the next one says spread understanding that religion does not demand FGM. This traditional practice should stop. Some persons do it because of religion. You say, is this religion that does it? It's not. It shouldn't be so. It should not be part of your culture. That very thing should not be part of your culture because it has to do with life. So if you're talking about this is my culture, the culture of my fathers, the culture of my people, the question I'm asking is that is culture not supposed to protect the interests of the people? It's supposed to. It's not supposed to be detrimental. It's not supposed to have any side effect on you. So if I'm following a particular culture, I should be benefiting positively and not negatively. Thank you for that. And then the next point says tackle the secrecy that allows cutting to continue. You understand? You need this secrecy. They will not tell you. They will not tell you. Some person will be asking, Patricia, how do you know? I know. I'm a guidance counselor by profession, so I know. We've had encounter with so many people. So I know. They do it as a secret. They will not tell you. Some will tell you, let's go to your uncle's place. Well, I want you to go and I want to take you there for your holidays and the rest. You'll be happy you're going. They have planned you. They will buy those things and keep. They will call you. You see them holding you. Keep. Forceful act. Forceful act. So, we should not. We should tackle the secrecy. Once you start seeing those conspiracies, find your way. Genital cutting was an initiation rite for girls. It was to prepare them for their future. The whole community would participate, but now it has become more controversial, and it usually takes the place discreetly at home because they know that people will gossip. Yes, people like us will gossip. Me, I will gossip you. If you do it, I see it, I will report you. I have said that before. I'm not hiding my mouth. If you try it and I get to know, I'll report you. Personally, I'll report and I'll let you know that I have reported you. So it is not good. So some persons, because they know that World Health Organization, the government of Cross River State is against it. The government of Cross River State is against it. In fact, the governor's wife is totally against it. She's against female genital mutilation. Reverend Mrs. Yombase too has mentioned it that no woman should face that kind of suffering and torture. Nobody should stress a woman like that. So if you do that, we will know where to channel your report. We will report you to her. We will report you to the state government. We will report you to police. We will tell every security agent about you. That is inhuman. So please be aware of this one. And then the last but not the least point says, keep pushing for FGM to be banned. That is what I am doing. Keep pushing. Go on social media, talk about it. Do your TikTok, talk about it. Do your videos, talk about it. Go to school, create awareness about it. Do sensitization programs. Teachers should teach their children from the classroom. Leaders should talk about it in their community. If you're a chief, tell your people not to do it. Because if you conspire with your community people to do FGM, when they come to arrest, we will start from that chief house. We will arrest you for conspiring to do such inhuman acts to your fellow human being. We will arrest you. Then the final point says, raise awareness. Awareness days like International Day of Zero Tolerance for FGM. Yes. They are all great days to create awareness. So we'll go around and tell people that it is bad. At this point in time, I don't know if you have learned anything. If you feel what I'm saying is not really true or you're not in support, you can Google it. Or you can carry out a survey, of which we are planning to. Very soon, there's a project we are about to doing. We'll carry out a survey. We'll go into villages and know the people that have been circumcised. We'll not write their names, but let them tell us their experience. And then we'll also get information from people that have been circumcised. We'll also get their experience. We'll get to know all these things so that people will understand that what we are doing is not a joke. So we have come to the end of today's class. If you have any question, please just ask me. Oh, thank you, Project Grace Foundation. Thank you. I appreciate. If you have questions, ask me. You can come into my DM, ask questions, you know. You can even drop your message or your question. I'll answer every question you ask me. So at this point, I want to thank you for being part of this class and staying with us and believing in our class. I promise you that I won't stay this long anymore. However it is, I'll always create time to be here. We are still learning every day. So at this point in time, it's still your baby. It's still your lady. It's still your counselor, Ambassador Patricia Godwin. And it's a bye for now. Bye.